I'm Dr. Charles from PHI Preventive Health Institute, and today we are talking about antibiotics used in pelvic inflammatory disease, PID, and why how you take them determines whether you truly recover or develop long-term complications. There is a way. PID usually shows itself in pattern that patients go through. Symptoms begin: lower abdominal pain, unusual discharge, discomfort, sometimes fever. You seek care. Antibiotics are prescribed. Treatment starts. After a few days, the pain reduces. The discharge improves. You begin to feel better. And then the pattern shifts. Doses are delayed. Some are missed. Treatment is stopped early because it feels like the infection is gone. But that is where the real problem begins. Because in PID, symptom relief is not the same as bacterial clearance. Now step into the system. Antibiotics do not just kill bacteria instantly. They work by maintaining consistent levels in the body over time. Level rises, raw bacteria are suppressed. Level maintained, raw bacteria are eliminated. Level drops too early, raw bacteria survive. So when doses are missed, the system becomes unstable. Drug levels fall below the effective range. Bacteria are exposed but not cleared. Some survive, some adapt. This is inconsistent dosing leading to resistance. This is not just theory, it is what we see in practice. Now layer the consequences. When infection is not fully cleared, it does not always remain obvious. Sometimes it becomes silent, but internally, inflammation continues. And over time, that leads to structural damage. The fallopian tubes can scar, fertility can be affected, chronic pelvic pain can develop, and future infections become more difficult to treat. It becomes a reproductive health issue. Now bringing another layer, medication use itself. PID treatment is not a single drug, it is often a combination. Each antibiotic targets different bacteria within the same system. So skipping one or taking them inconsistently breaks the balance of treatment. Side effects may occur, nausea, discomfort, but stopping without guidance creates a far greater risk than most side effects themselves. Another critical point, reinfection. Treatment is not complete if only one person is treated. One partner treated, the other untreated. Now look at the full system. Correct diagnosis, right combination, consistent dosing, full completion, partner management, all connected. Feeling better is not the goal. Complete eradication is. This happens only when medication is taken exactly as prescribed. If symptoms return or you have difficulty with medication, do not adjust it on your own. Seek proper medical guidance early. Because in PID, how you take your medication determines your future. Contact your doctor or call/WhatsApp +233 2087 20347